Hello everyone, I'm Arpit Tripathi, counseling psychologist. I'm going to talk to you about intellectual disability. A couple of minutes before you read about it, that what is intellectual disability. Now, let us talk about it in detail. Previously, intellectual disability was known as mental retardation. The term mental retardation got replaced with intellectual disability. The basic sign of intellectual disability is not meeting the developmental milestones, which is also known as developmental delay, which simply means not meeting age appropriate expected developmental change in the nature. Most of the time, when a child misses the developmental milestones, parents feel that the child will learn after some times. This is known as wait and watch approach by the parents. Not all the child with developmental delay will learn the age appropriate expected behavior by their own. Child with intellectual disability will have persistent delayed development. The more delayed extra care will be given to the child, the more poor child's learning skills will be. Early interventions help in managing the challenges in far better way. There are two major signs of intellectual disability. Number one, low IQ. IQ means intelligence quotient, and the number two is poor adaptability skills. So let us talk about what are poor adaptability skills, or basically what are adaptability skills. Many kids with intellectual disability need helps with adaptive skills, which are skills needed to live, walk, and play in the society. Teacher and parents can help a child by working on these skills. Number one, communicating with others. Number two, taking care of personal needs, for example, dressing, bathing, going to washroom, brushing, washing hands, etc. Uh, so number three is health and safety. Number four, home living. That is helping to set the table, house cleaning, cooking, um, the stuff which we used to do at home in a normal routine. Number five is social skills. That is manners, etiquettes, knowing social rules of conversation, playing games, uh, compromising skills, etc. Number six, reading, writing, and basic mathematics. And number seven, as they get older, skills that will help in workplace. For example, organizing things, counting money, or money handling, handling things, holding things, etc. So all these adaptive functioning skills can be divided into three basic domains, and they are conceptual domain, social domain, and practical domain. So let us talk about conceptual domain. Conceptual domain includes language, knowledge, and memory. Social domain includes empathy, social judgment, and rule following. And practical domain includes self-care, organization, and daily life skills. Now we are going to discuss about the causes of intellectual disability. So there are basic three causes which I tried to explain in brief in the presentation, and many other more. So number one is genetics. Researchers have shown that if there is a family history of intellectual disability, the chances of intellectual disability in the born child increases. Number two is prenatal and postnatal conditions. Any complication related to pregnancy, uses of alcohol and drugs by the mother during pregnancy, or accident, traumatic events, or damage to the brain in lack of oxygen while the delivery process was going on, brain fever just after birth or after few days, any serious infection in the initial 3 months after birth, which can affect the brain directly. So these are the basic tools. And the number three is intelligence quotient. See, IQ we cannot increase by any sort of medical treatment. So by giving early interventions, we can help the child to have far better skills to live his life smoothly. So after understanding some causes of intellectual disability, let us talk about some symptoms of it. So some symptoms of intellectual disability includes below average IQ level, I have explained it in the PDF which you have read before this video: acute, moderate, and severe. So these are the basic three steps, or the basic three IQ level: acute, moderate, and severe. And it can be accompanied by certain motor difficulty. Number two is delayed development. Number three is child finds it hard to remember the things, struggle to understand how to pay for something, for example, having trouble in money handling, etc. Number four, trouble understanding social rules. Number five, having poor self caring skills. Number six, poor social adjustment. Number seven, having trouble in understanding the consequences of their own actions. Number eight, poor problem solving approach. And number nine, poor approach towards logical thinking, or poor logical thinking approach. So let us talk about some of the interventions. As a teacher, you can help in major five areas. Number one, scheduling. For example, giving extra time to complete assignment or test. Sitting, that is, allow the child to do his work in smaller group or with a partner. You can also use the buddy concept. Number three, materials, providing notes by the teacher, or you can tape the lecture for the child. Number four, instructions, breaking the lesson into smaller parts and helping students to complete their work as a tutor. As a tutor means giving special extra attention or the individual attention. Number five is student's response, that is allowing the student to respond orally or on computer. Let us talk about few more interventions. So do the repetition of the concept over the days. Giving hands-on learning using means using all the senses in learning can help them in retaining the information for a longer period of time. Taking safety measures inside the class, like sharp objects, scissors, knife must be kept out of reach. Harmful liquids can be kept separately, and it is a must. I think it will help you in the classroom management. Then let's like we need to observe and motivate the child to involve in classroom activity. Be as concrete as possible while teaching concepts. Then give immediate feedback so that the child can relate with the consequences of their own behavior. Help students to learn life skills such as personal hygiene, health and safety, getting along with others. Then addressing the social aspects of school, like as a teacher you need to tell them that they come to school to learn social skills as well. If anybody is bullying them, or like disturbing them, or making their fun, whatever, they can directly approach to you for that thing. Then in the intervention we can also give more time, like individual attention, and practice more than usual. Practical demonstration of teaching with the real objects. Simple instructions in easy language to be given in the class. Teachers should empathize always with the child's disability. Child may have difficulty in understanding social norms. Role of a teacher is to understand that these are due to symptoms of disability. Such behavior can't be tagged as a bad behavior. So activities based on developing self-acceptance and boosting self-esteem should be a part of child's regular learning in the classroom as well as at home. Rules and etiquettes of social communication focused training and live practice of money handling can be done in a school canteen, or you can also with the help of parents you can also demonstrate in the neighbor with the neighbor shopkeepers and all. So I wish to share a case study here, that once a teacher was a teacher just was having a intellectually disabled child in his class. And what happened, when once the father came and he said that my child is having intellectual disability, so the teacher was a bit aware about the intellectual disability, and the father said that my child is diagnosed with this thing. So the teacher straightforwardly said that, sir, your child is definitely not going to be very good as other social students and all. And the father started crying. My message beside this slide is simply that don't be very direct, or don't say direct so which can hurt to the parents, because it is our job to empathize with their situation, and it is our job to help them in handling the child effectively. So patience is the biggest thing in this profession while a teacher is handling a child inside the class. So don't be very direct towards a parent, and do not ask leading questions. Develop acceptance for the child so that the child also feels comfortable with you, and the child shares the weaknesses and strengths with you, and you can work upon it. Accept the child with a non-judgmental attitude. Do not judge it with the other kids and all. And overall, in the last, I say that do your best. Doing your best will give you the extreme highest satisfaction. So for your better understanding of intellectual disability, there are few MCQs. It is requested to you that just have a look to these MCQs, that which are the right answers, and you can move with this. And there's a reflective question as well. So once you are done with the MCQ, multiple choice question, you can move to the reflective question, and you can think about it and you can work upon it. So with this, I'm going to wind up the discussion here. Thank you, and Jai Hind, everyone.